Dear viewers, welcome back to my session. We are going to talk about gallstones, everything about gallstones, and the management of these stones. But before I start, I would like to introduce myself again. My name is Dr. Piush Choudhry, and briefly I can explain to you about myself. I joined mbbs in 1988 when I scored a rank of 123rd All India CBSE examination, and then first professional I got honors in anatomy, physiology and biochemistry. Then I ventured into my own interests, like I visited Australia in the middle, and later on managed to work in neuroscience there, and also kept my interest going in practice. Have visited a lot of countries, European countries and America and Australia. So with my experience, I can only tell you that you can strive to achieve what you want. And now I would like to meet more and more people now, learn more from you also. So it's a continuous learning process. We will go with it. And back to my topic now. My topic is all about gallstones today. So let's start with the anatomy of gallstones. Where is the gallstone? Where is the gallbladder? So for the purpose of convenience, there are 9 subdivisions of the abdomen. So there are 2 lines which are passing on either side of the midline. And these 9 divisions form what we call as quadrants. So you have in the above zone, the middle zone and the lower zone, which covers the entire abdomen. In the upper zone, you have an area called right hypochondrium. Then you have the epigastric region, and then you have the left hypochondrial region. The middle is where the umbilicus is. You have the right lumbar and the left lumbar with it. And in the lower regions, you have the right inguinal fossa region, you have the hypogastric region, and the left inguinal fossa region, iliac fossa region. These are the basic quadrants which we can think of. Now the liver lies in the upper and the right part of this quadrants, abdominal areas. And where is this liver? In the right and the upper part of the abdomen. A gallbladder is a structure which lies below, underneath, and nestles into the liver in the coniac segments of 4B and 5. Now we'll talk about these segments very briefly. So there are 8 segments. Some talk about the 9th segment, which was the first segment, but we'll talk about these 8 segments starting from 1, 2, 3, 4, which is on the left side, then on the right side 5, 6, 7 and 8. So I'm sure you can check up your books and you'll understand this also better. So focusing just on the gallbladder right now. Gallbladder is seen in the 4th B and the 5th segment. And what is the importance around the gallbladder? What you see? You will see a sulcus there when you see the underneath of the liver, and that sulcus is called the rouviere sulcus. Now this rouviere sulcus has a line that extends at the segment 4 of the liver. This line is called the R4U line. Above this line you can operate, and below this line it's an unsafe zone to operate. So I'll repeat again, rouviere sulcus. This is the area that needs to be marked. It is called the guardian angel of a gallbladder during surgery. Above this area is a safe zone. Below this area is the unsafe zone. Anterior superior in this rouviere sulcus is the cystic duct and the gallbladder region, and below this is your CVD region, which is to be prevented. Any injury is to be prevented in that area. So my entire exercise is going to be from the surgical point of view. for the gallbladder itself, the anatomy is simple. It has a fundus, it has a body, and it has a neck. The position we know where it is underneath the liver now. And now we can talk about other structures that are close to the gallbladder. What will be the structures that will be close to the gallbladder? You have two ducts which will be coming out of the liver from there, the right hepatic duct and the left hepatic duct, which will form the common bile duct. And then through there is a cystic duct that arises from there and goes into the gallbladder that contains the spiral valve of Hista. What is the use of the spiral valve of Hista? You will have the right hepatic and the left hepatic duct, the common hepatic duct, the bile is going inside the gallbladder, but it is not going to come out of the gallbladder until the gallbladder contracts. So when it comes out of the gallbladder, it goes into the common bile duct and then into the second part of the duodenum, where it joins with the pancreatic duct, and then you have the ampulla of Vater there. So this is the basic structure of what we talk about the gallbladder right now. Going a little further than this, what are the arteries and what are the nerves that will be supplying the gallbladder? You have hepatic, which is the common hepatic artery, then the right gastric artery, splenic artery. Common hepatic artery will give you the gastroduodenal artery. Then that goes into hepatic artery proper, and that forms the right and left hepatic artery. The cystics from the right hepatic artery. And then when it goes onto the gallbladder, it divides into the anterior and the posterior branches. This is important because while you're operating, if these get injured, then you'll have to open them or manage it. So now we know a basic structure of the liver, which is you have this sulcus there, rouviere sulcus, and you have the gallbladder, and then you have these structures, which is the cystic duct, the common hepatic duct, and then the common bile duct. So the cystic duct underneath the surface of the liver and the common hepatic duct, they form a triangle which is called as the Calot's triangle. So this is where you have to dissect the structures there. Okay, so now we come to the nerve supply. It has a So now we come to the sensory and the parasympathetic and the sympathetic innervation of the gallbladder. The sensory is with the right phrenic nerve. The parasympathetic innervation is from the right hepatic branch of the vagus nerve, which relaxes the gallbladder, and the contraction is by the sympathetic plexus, which is coming from the celiac plexus. So the contraction is subsequent to the release of the cystokinin, which is released by the small intestine, and then the gallbladder contracts. When we see the symptoms, usually patient will present to you with some form of dyspepsia half an hour after having a meal, and after that there could be any sensation of pain in the right upper quadrant region. Then there is fever, they could be there, and jaundice could be there. So these forms the Charcot Triad. Basically, two important signs which you need to elicit here are the Murphy's sign and the Boa Sign. So Charcot Triad also you have associated lower BP and mental symptoms, so that is called the Reynolds Pentad. Now that is when the cholangitis occurs. That is where the CBD is getting affected now. And the Murphy's sign is where at the zenith of the inspiration, if you palpate in the right upper quadrant region, that is where the pain occurs. And Boa Sign is hyperesthesia of the 9 to 11 ribs, which are present on the right side. There is often infrascapular pain also, or pain in the right shoulder region that can occur due to viscerosomatic innervations. So this is in brief of what I am talking to you about the anatomy and the blood supply and the nerve supply. Now I'll make